Chapter 52. So let's talk a little bit through drugs affecting the urinary tract and bladder. Now, we've already talked about anti-infectives, so that's a whole different ballgame when you have an infection. However, on page 873, there's different problems that we're trying to treat with medications that are for this area. Urinary tract problem, we're going to be looking at infection, spasm, pain, or BPH, benign prostatic hyperplasia. And each medicine will be doing something different in relation to what we're trying to treat. Makes sense, right? But let's think about this as we go forward. So if we have an infection, we're going to be looking at, we talked about the drugs that really work well, the Cillins and all those types of things. But let's look at ones that are specifically for urinary tract. And so, urinary tract infections are the most common in the United States, as it says on slide 2. More common in females because of the urethra being right there and located close to the rectum. You can get that E. coli that migrates there on its own sometimes. So, urinary tract infections are very common. Women can suffer greatly with urinary tract infections. So, being sympathetic to the pain that's there, and that's why there's that section on pain management that will go forward. So signs and symptoms, you look at in slide 3, you already learned about this. You have urgency, frequency, burning on urination, chills, flank pain, tenderness. That's when it gets worse. So when we look at treatment for UTIs on slide 4, antibiotics, but also we can utilize agents that sterilize the tract and help with the pain that's associated with. So let's go forward to the sites of action. Slide 5 is really a great slide in that it tells you exactly where urinary agents, analgesics, work within the bladder itself. You have the antispasmodics that work in the muscle layer. That makes sense, right? The anti-infectives work within there as well. But let's go forward. And sorry, let me toggle forward really quick. So norfloxacin is the prototype on slide 6. You look at it's really effective against gram-negative stains. There is phosphomycin. It's one dose. Don't see it being used quite as often as in the past. But as we look at drugs on slide 7, methylene blue used to be used a lot. It's not anymore, so don't really focus on that. So then, anti-infective, slide 8. We're going to be looking to destroy the bacteria itself. And so remember that we want to attack UTIs early before they get up into pyelonephritis and really can become damaging to the nephron and to the kidney itself. And so nausea, vomiting, anorexia, bladder irritation are side effects on slide 10. Dysuria. Norfloxacin is on slide 11 as your prototype. And it really works well with gram-negative. E. coli is what you think about, and it interferes with the DNA replication. The onset varies, as it says. So, but really, anti-infectives we're going to use the ones that we learned in our, first week, which was 8 weeks ago or more. So, but that won't be on your exam. We're specifically looking at what's in this chapter. So, anti-infectives. Yes, there's that type of classification, but let's look at antispasmodics on slide 13. Block spasms of urinary tract muscles. What does this? Sometimes people need to be treated with antispasmodics when they have urinary dribbling, incontinence. So these drugs on slide 14 are rapidly absorbed. We're going to be cautioned, of course, with renal and hepatic dysfunction. And there is your prototype on 16, which is your oxybutynin, which relieves symptoms of bladder instability. And it acts directly on the smooth muscle in the bladder. Inhibits the effects of acetylcholine. Now, side effects. CNS stuff, drowsiness, blurred vision, tachycardia, dry mouth, of course, is there, urinary hesitancy, decreased sweating, all those things that dries up your patient. That's going to be what's happening with this drug. However, many people who take this for their incontinence issues really report good outcomes. This is one of my favorite drugs in slide 18, which is the phenylpyridine or pyridine. Is what it does is it releases symptoms related to urinary tract irritation from infection, trauma, surgery. You can get this over the counter. It's azo. You can find it by where they have yeast, vaginal yeast suppositories, where they'll have cranberry juice things there. They'll have azo will be there, because of course, and you can get the test that will test for UTIs. On occasion, women will need to take this not only because they have a UTI, but because they have an irritation related to being dehydrated too much, and they just rehydrate and it gets better. So you can tell that I've talked with many women about this over-the-counter drug, pyridine. The one thing that we need to take care of is, let me go to slide 19, is it is well distributed, it's excreted in the urine, and what you need to know about it is the urine will turn orange. Bright orange, yellow orange-ish. And it will turn orange so much that on page 20, reddish orange coloring of the urine, it can stain. So we want to make sure that people who are taking this are aware. I say women because it's primarily women who are utilizing this drug. But it is a really effective drug that will help decrease that acute discomfort of a UTI or other irritants of the urinary tract. So again, this is a really great drug for you to keep in your pocket for, you know what, they can't get to the doctor until in the afternoon and it's burning so bad and they can't focus. There you go. This is a great drug that can help. You can still do a urine test even if you have pyridine on board. Even though the urine is colored, you will still get the sensitivity, the culture and sensitivity results appropriately, even though you have pyridine on board. Okay. Bladder protectants, we're not focusing on this too much. Interstitial cystitis is a real annoying thing that can happen to many women. So I'm looking at, there's no prototype that's listed there, so that's fine. Just know that it's there. So let's finish off with BPH. We've talked about BPH a little bit, about how it can be a challenge. You've learned about it in your pathophysiology. So let's go specifically to the one that they have here, doxazosin, which you may know of it as Cardura. But what it does is it relaxes, it works on the vascular smooth muscle cells, and it relaxes vascular smooth muscle tone. Vasodilation, which decreases vascular resistance. Sometimes you can have decreased blood pressure with this, so I think a Cardura is a cardiac drug as well. And so as you look at this prototype on page 28, note that you can have headache, dizziness, fatigue, postural hypotension, lethargy, vertigo, tachycardia, palpitations, nausea, dyspepsia, diarrhea, sexual dysfunction, and rash. Wow, that's an interesting combination of side effects, and so you can appreciate how your patient might be having a challenge with side effects with this drug. As you go forward, there's the use of drug effects throughout the lifespan on slides 32. Keep in mind that children do develop UTIs, and so we need to not only give them education on hygiene, but also help. There can be sometimes congenital problems that make UTIs more common. So doing copious patient education is important, but also it notes that the nitrofurantoin, the older anti-infectives, work great with children. Adults need to be cautioned, again, do health education. And with BPH, we need to make sure that those men are being taught the signs and symptoms of the drug itself. And let me just get into the book really quick to see if we missed anything that would be extremely terrible for me to forget to point out. Again, do the questions at the back of the book and read the blue box, which talks about encouraging people to drink fluids. That makes a lot of sense. Patient teaching, dosages. The use of cranberry juice is really, really great for UTIs. and cranberry juice has been proven to be effective. So look through chapter 52. They're the basics. So I hope that this little talk through of this chapter has helped, and I look forward to seeing you soon.